0203 515 1035. My name is DEEP RAJAH. This is DilSe Radio. Now, this is the time where doctors stop treating. No, they don't go on strike. They just cannot help but listen to me. Nurses stop working. Porters stop cleaning. Hospitals completely stop. Why? Because it's Medical Monday. It's that time again where the advice that is given and the advice that is listened to makes the difference. It's your Medical Monday. With me in the studio are my very good friends from Komao Medical Group. Dr. Aman Sharma, very good afternoon to you.
Hello, good afternoon, Deep.
Thank you very much for coming back on to Let's Talk and Medical Monday. I want to pick up from where we left off, and I'm going to start with what we did or what we discussed last week, because there have been so many people asking me about this, and that is aftermath, aftercare, understanding what the hell that is. And I say hell because some people go, oh my gosh, the pain that I've gone through after having that operation, after having that chemotherapy, after having that Botox, it's really, really bad. And there's nobody there to pick up the phone to. What can you say to that?
Aftercare is very important because, after a procedure or after you see your doctor, a lot of patients, they've had their treatment, but when they leave the room, they have a lot of questions, that they want to ask. They have a lot of anxiety that needs to be addressed. And because, they've left with all that information, or they've gone home with this procedure done, and they have to look after themselves. They have to, that responsibility that in the consultation is now, on their shoulders. So it's a lot to wear. It is quite stressful. But that's where we can help. We're there on telephone line. Follow up appointments. That's is aftercare is extremely important.
Do you think that the aftercare Komao Medical Group could provide is, how shall I put this, more one-to-one on a basis? Now, let me give you an example and see if we can do this. Gentleman or a lady has hair reformation.
Yeah.
Maybe even Botox. Now, they go home, and after, say, 2 weeks, they're getting a bit of pain in their head or a bit of a pain in the jaw, right? It does happen because the body doesn't like to accept things in 1 minute.
It does happen, yeah.
Right. What can you do to make sure they do not feel left? Not like that. What can you do?
So, in this kind of situation, so let's say, for instance, with the hair transplant operation, the patient will experience, I'm not going to lie, a lot of discomfort the first 2 days, first 3 days. So in this kind of situation, I want to make sure that patient knows that I'm available to, they can call me, they can send me messages, we can book a clinic appointment for them to come so I can see the operations, how, if there's any scarring, any inflammation. So I'm available. So come, we can prescribe extra medication. Usually we have a set regime for the patient, like to apply a steroid cream at the back of their head to reduce the inflammation, and we give some painkillers. But if that's not working, then we can always increase the dose, or if the patient is not in any pain at all, then we can even increase the dose. So we can tailor the aftercare for that patient and how he's responding to the treatment. We always have a follow-up appointment with any patient we do in our clinic. It's not like you go abroad to Turkey, you do your operation, and you never see the doctor again. Here we make sure we're seeing you regularly, 2 weeks, so we can even see you earlier than that. So
can a patient call you when they want? I agree, it's a great idea every 1 week, 2 weeks, there's no argument there, but sometimes some patients can get a bit sensitive when it comes to the head operation or something, and something goes wrong, a little bit of pain or something. The 2 weeks hasn't elapsed. Can they call you in between and say, look, I need to see you? Yeah,
absolutely. They can do that without a doubt. That's something that we can offer at Komao. So it's quite unique. I don't know if many clinics do that, but we do offer that. They can call me, especially for all our hair transplant Botox patients. They can call me.
Okay, look, we're going to continue after a quick commercial break. But what we're going to look into as well with you guys at Komao is what kind of services you offer when it comes to follow-up treatment. When you look at private GPs, sometimes we were talking about prescriptions and stuff. Can we sort that out at your surgery? And I think the most important thing that we have to look at today as well is the age of the patient. If the patient, for example, let's say is going for Botox, is there an age restriction? If the patient is going for hair loss, is there an age restriction? And, I ask because as we're living longer, more and more of us want to still look 50 when we're 80.
Yeah, of course, yeah.
So can we really do that in terms of, our facial features and our Botox and our hair. If you want to speak to him, by the way, 0203 515 1035. I'm with Dr. Aman Sharma, who is from our very good friends at the Komao Medical Centre. What I want to know from you, my lovely friends and listeners, have you had hair transplants? Have you had Botox? Have you had perhaps a private GP? And if you have had all these, or even one of these things, I would like to know your experience and what you would like to see from somebody like Komao Medical Group and Dr. Aman Sharma, so that it makes your life a lot easier. You see, at DilSe Radio and Medical Monday, we're not just here to throw hospital advice. We want your advice so that we can make this a two-way street. My name is DEEP RAJAH. This is DilSe Radio. Very good afternoon to you. A very good afternoon to you. It's Medical Monday with me, DEEP RAJAH, and in the studios are our very good friends from Komao Medical. And what are we saying here? We are talking about the aftermath of treatment and why it is important to make sure that that treatment is done. Dr. Aman Sharma, let me ask you very straightforwardly here. Yes, we all have a wish to have maybe some more hair put on our heads, maybe to have Botox to stop some pain or make our skins look nicer. We also have a wish to have a snap at our fingers and the doctors there. But are there any age restrictions, first of all? If I walk in and say I want a hair transplant, what is my age? Can I do it? Can I not? Is there a restriction or not?
Yes, so there are age restrictions for both Botox and hair transplants. So the cutoff limit, there's always a minimum limit. So we won't do anyone under the age of 20 years old. And then from 20 to 30, there is extensive screening as well before. So it's not just because you're between 20 and 30 we say yes. Even between 20 and 30, we have to look very carefully. Let's say, for instance, a hair transplant. If you're going to have a hair transplant, like say 22, 23, it's very likely you're going to need at least another 2-3 more procedures for the rest of your life, maybe even more. Some people have even more. So you have to be very careful with these patients because of their age and make sure they've tried everything else before they go down the hair transplant route. So I would be more comfortable late 20s, 28, and anything from 30 above. But early 20s, again, I would have a very extensive screening program.
What about the lateness? What's the latest I can do it?
So lateness, there's no real late cutoff with either Botox or hair transplant. It all depends on medical comorbidities. So if, for instance, I'm seeing an 80-year-old man, he's got diabetes, he's on blood pressure medication, he's on blood thinners, then I would say, you're not a good candidate for hair transplant. I think it's best to avoid it. But some 80-year-olds are extremely fit. They do marathons. They're not on any medication. For these kind of people, and if the hair outline is good enough for a transplant, then I would go ahead with it. But again, their recovery time might be a little bit longer, but I would follow them up a little bit more frequently. But the age limit for the older age is not as stringent as the younger age. We have a strong cutoff point for the younger age.
So, for example, if I was 80, 81 and wanted to have Botox or perhaps wanted to have a hair transplant, now look at it in terms of a woman. A lot of women like to keep their looks. Men, I guess I'm not going to go into, but a woman who may be suffering from a bit of hair loss, or a woman who may be suffering from or wanting to put a bit of Botox, would you do it on an 80, 81-year-old lady?
Yeah, again, it depends. Again, so even with Botox, there are a lot of comorbidities you cannot do Botox for. So, for instance, if as the patients got older, they've developed any muscular problems, they're taking a long list of medications like aspirin, warfarin, they are currently on antibiotics, or sometimes some people are on long-term antibiotics, for instance UTI, urine infections, then again you can't do it on these patients. But there are some very, very fit 80-year-olds and they are still having Botox done and they want to look good at that age, so we shouldn't deny them of that treatment, especially if they've got no comorbidities, no complications. Then
okay, moving on from that, we're talking here about aftermath a bit, right? And one of the key things that I notice when it comes to aftercare, I just want to move to this private GP business. You offer a service that can perhaps give a patient the ability to maybe speak to the GP a bit more. All right, I'm not arguing there. But do you feel that private GPs would make a bigger difference aftercare as compared to, say, them being left and having to speak to their, NHS one?
Yes, so I think the main difference is with a private GP, I can offer more of my time to the patient. So, for instance, aftercare, like I'll give you an example. I saw a patient, he had first diagnosis of epilepsy. We took care, we did all the investigation for him, referred him to the specialist. But then after that, he needed more medications. He ran out of his medications, and I could do it very easily for him, and I was available for him to get hold of very easily. Whereas if it was, an NHS appointment, he'd have to wait probably 3-4 weeks before he'd see his GP and get his important medication. So it's a very big difference, and unfortunately, the difference always comes down to time management. I can offer more of my time to the patients.
When you say time, are you talking advice?
Advice, yeah.
That's the point here, isn't it? That when you are with somebody, a GP, an NHS GP, love them to bits, no argument. But, I have often been told, I'm sorry, I can only speak to you about this. I can't speak to you about that because I just don't have the time. I've got 15 patients in the room. What do you want me to do?
Yeah.
So this is where you come in and say, well, look, sit down, calm down, and let me explain to you, which I think is very important, because if you're seeing something abnormal, or the patient thinks it's abnormal, and you say, no, it's perfectly normal, this crack, this skin bleed, this thing, it's perfectly normal. We panic.
Yeah.
And you can put their minds at ease. I want to look at this point. Stress. When you are stressed, is it true hair loss can happen a lot?
Yeah, definitely. So if you're very stressed, you can start losing your hair. There's actually a medical term for this. It's called pterygium effluvium. So there's actually a medical...
pterygium effluvium.
Yes.
Now, if pterygium effluvium happens, i.e., is that mainly in men or is that in women?
Both men and women can happen. Both stress is the biggest contributor to that. You can definitely start losing your hair from that.
So let me ask you this, and I'm going to sound very controversial here. Don't take it, take it in the wrong way. Asians tend to have a lot more body hair than a lot of other male Western counterparts.
Yeah.
Yet Asians do get stressed. I don't see them losing body hair.
So body hair is different to the hair we have on our scalp. So the body hair is a different type of hair. It's a more silky hair, whereas the hair on our scalp, it's directly related to the amount of testosterone we have in our body. So the more testosterone we have, then we tend to lose our hair. Or if you're stressed, you tend to lose your hair. Or if you have lack of iron in your body, lack of calcium, all these kind of things can make you lose the hair on your scalp. But you won't notice any changes on your body hair because they're both different types of hair.
You can, in effect, lose your hair on your head and even go bald, but still have a lot of hair on the body.
Yeah, unfortunately, the body hair will always stay there. It's not going to go anywhere.
I want to find out from you if aftercare means relaxation in stress or not. And therefore, if we have more, can you as a GP, you as a sort of person who deals with Botox and hair loss, can you make your patients, don't answer this yet, de-stress? And if you can, do you think your treatment, again, don't answer this now, do you believe your treatment and the treatment you give the patient is far more effective? They start off tight and muscle gripped. My name is DEEP RAJAH. This is DilSe Radio. It's Medical Monday. Good afternoon. And a very good afternoon to you. My name is DEEP RAJAH. This is DilSe Radio, and you're tuned into Let's Talk. And on Medical Monday today, I've got my very good friends here from the Komao Medical Group. And what we're talking about is looking at aftercare. I want to finish this point, and I also want to look at stress-related diseases to aftercare. Dr. Aman Sharma, let me ask you this. When it comes to aftercare and when it comes to stress and when it comes to this, yes, you mentioned that stress can be a factor. But do you believe, or can a GP give after stress? Let's put it this way. Let's say a patient has a panic attack afterwards, wakes up and sees a bit of blood on the pillow or whatever it is, and starts panicking. That's what I call a panic attack. Do you feel that a doctor, can you make people a bit more relaxed?
Of course, you definitely can as well. I mean, that was probably 90% of our job is to alleviate stress and to reassure patients when there's nothing to worry about. On the other side, if there is something to worry about, you don't want to give false reassurance. So the main way we would help in any of this kind of situation is making ourselves readily available. So if anything's going on, come and see us. You don't have to wait 2, 3, 4 weeks. You come straight away, see us, so we can look at the problem and deal with it. An example is a lot of patients I've seen in my experience, they have blood in the toilet when they go to the toilet. Stool, yeah. So this causes a lot of stress for people, because everybody associates blood in the stool with bowel cancer. So the minute anybody sees that, a big alarm bells start ringing. But there are so many reasons why you get blood in the stool, and in fact, bowel cancer, it is an association, but you need to look at the history. And if I see 10 patients who've got blood in their stool, 8 out of those 10 patients, if I look at it, properly, then they don't need to be stressed and worried about it, because there's another reason. It could be constipation, it could be hemorrhoids, it could be something else. So you need to take a thorough history, and if it is something more sinister, then we need to act on it and make sure they're investigated quickly. So that's a very important point.
Okay. 0203 515 1035. If you want to speak to the doctors, go ahead now. This is your chance to have a chat with him. Have you had Botox? Have you had hair transplant? Have you had anything like that? 0203 515 1035. What were the results? Why did you do it? What problems have you got? Now is your chance to get a little bit of advice. Also, have you had a private GP? And if you have had a private GP or thinking of having a private GP, what is your fear for not doing it? What is the questions? You can call him now. My other point to you, my lovely friends and listeners, is if you want to go to the Komao Medical Group, I will be sharing your or his numbers later on. And I know that sometimes when you're not talking to me, it is a personal matter, and you may want to talk to him straight off the not off the record, but not on the radio, and that's fine. You can talk to him directly or his staff, and they will sort you out. And I will be sending you the numbers soon. Dr. Aman Sharma, I want to also ask you, when it comes to aftermath and aftercare, if a patient is disabled in any shape or form, perhaps they've got mobility issues, perhaps they've got I don't know, maybe mental health issues, can you still perform a Botox hair transplant, or would you be sort of reluctant to do that?
No, I would be quite reluctant to do it in this case.
Really?
Yeah,
why
definitely.
is that?
So if they've got mental health problems and they're coming for, let's say, Botox, they have a lot of anxiety, and then they think that by having the Botox they can help with the wrinkles. It's not the right approach, because even if we do the Botox and we get great results, the patient is still going to be anxious even after that. So you need to deal with the underlying anxiety before you go ahead and do any of these kind of procedures. So you should always do a mental health screen on any patient that's coming for any cosmetic procedure.
Okay. Tell me more a little bit. Let's put it this way. Let's say that you have, how can I put this in the nicest possible way? Let's say that you have a patient who's not satisfied with the treatment, or the patient who's not 100% happy with what they've done. How or what can you do to reassure them, everything will be okay? You can't satisfy everyone all the time. Yeah. And there's always one person that will complain. All right. What do you do to sort that out?
So it depends on the procedure. So for instance, for Botox, we'll review all our patients in 2 weeks' time, because that's how long it takes for you to see the results of your initial Botox treatment. And then after that, you can decide, do they need more of a top-ups, or you look at the patient and you see, are there any complications? If there are any complications, then you can treat it, you can give the necessary medication. But the thing about Botox is that the effects are reversible, so they don't last. The Botox that you give them doesn't last forever. So that is something to bear in mind. After 4 months, whatever treatment you give will wear off. That's why we recommend doing it at least 3 times a year.
The music you want, the news you need. DilSe.
It's Medical Monday with me, DEEP RAJAH, and we've been having Dr. Aman Sharma here as a guest and talking about everything medical, especially about aftercare and aftermath. We've got very little time left, so I'm going to ask you one question, and then I'm going to need your details for the rest of the listeners out there. My question to you is that when it comes to hospitals and when it comes to medical, larger private establishments, why would they come to you? What is it that you can offer, and how is the relationship between hospitals and people or client medical establishments like the Komao Group and yourselves? How is the relationship?
So one of the things is our waiting times are less. So if you go to hospital, you'll have to wait longer with other people. Other thing is we can give you more of our time, for the consultation, for the treatment, if you've got any questions, and also be more readily available. Like we've mentioned about aftercare the whole show. So that's another big thing. You can call me, email me, and then you can get that aftercare advice as well.
Okay, so the aftercare and the actual sitting there and having more time, because hospitals have a lot more waiting lists, have a lot more time. So, okay, tell me your if people want to get hold of you and book an appointment, something. What's the number and name, please?
So they can call us 0208 749 4640. Or they can email us at info at komao.org.uk. So Komao is KOMAO.
Komao.co.uk.
Komao.org.uk.
I'm sorry, .org.uk.
Yeah.
And you're in London?
We're in London, Shepherd's Bush.
Bush. And they can come and see you and mention DilSe Radio. Look,
exactly.
It's been a pleasure again, and I look forward to seeing you again next week with your lovely wife, who's also a doctor.
She is,
and I like that because you've got the man and woman's points as well.
Yeah.
But I think that it is very good that you're able to come in, talk about Botox, talk about this. We're going to look at another aspect. I want to go into the stress-related part of all this next week a bit further.
Yeah.
Because I think a lot of Asians tend to have stress problems a lot more than, say, other groups. And one of the reasons is because we have come from other countries and our parents are sort of pumping into our heads, work hard, do this, do that, and the stress there. Maybe we will look at we'll take a typical Asian family, and the guy says, "You've got to be a doctor," and he goes, "No, I want to be I want to be an actor," and the stress is maybe making him bald, maybe making him go put on weight, maybe making him get sick, and we got to look at how you and having a private GP can really make that difference.
Yeah, definitely.
Does that make sense?
Yeah, absolutely.
Okay, well, look, thank you again for coming in. Thank you for everything on this one, and I look forward to seeing you again next week.
Yeah, next week. Okay.
Take care till then. My name is DEEP RAJAH. This is DilSe Radio. You're tuned into Let's Talk, and